Welcome to another edition of Inspired Stories, where leaders share their experiences so we can learn from their successes, how they've overcome adversity, and explore current challenges they're facing.
Welcome to another edition of the Inspired Stories podcast, where leaders share their experiences so we can learn from their successes and be inspired by how they've overcome adversity. My name is Anthony Codispoti, and today's guest is Patti Artley, Chief Nursing Officer of Medical Solutions. They are one of the nation's largest healthcare staffing firms. Since their founding in 2001, they have connected nurses and allied health clinicians with hospitals and healthcare systems across the country. They have grown thoughtfully and organically by diversifying their service offerings and bringing like-minded companies into the fold. Patti herself brings 35 years of nursing and clinical staffing experience, having previously served as Chief Nursing Officer at the Medical University of South Carolina. She is passionate about nurturing safe, efficient healthcare environments and has championed several quality and safety initiatives in her leadership roles. Through her strong leadership, she has guided teams to deliver exceptional care, driving success in complex healthcare settings. Her dedication to team collaboration and patient advocacy has shaped her approach to improving healthcare systems. Now, before we get into all that good stuff, today's episode is brought to you by my company, Add Back Benefits Agency, where we offer very specific and unique employee benefits that are both great for your team and fiscally optimized for your bottom line. One recent client was able to add over $900 per employee per year in extra cash flow by implementing one of our innovative programs. Results vary for each company, and some organizations may not be eligible. To find out if your company qualifies, contact us today at addbackbenefitsagency.com. Now back to our guest today, the Chief Nursing Officer of Medical Solutions, Patti Artley. I appreciate you making the time to share your story today.
Thank you for having me. I appreciate being here.
So, Patti, what first drew you into the healthcare field all those years ago?
Oh, well, as you heard, it was a long time ago. I actually wanted to be a teacher. I come from an parents' education background and wanted to be a teacher. And my skill set was more suited for both math and science. So I decided to be a nurse. That's actually how I became a nurse.
Okay. And did you initially have a vision of getting to the stage of what you're doing now, or did that kind of happen more organically or even accidentally along the way?
Definitely accidentally. I never, ever thought I would be doing this. I never thought I'd be a chief nurse. When I pursued my master's degree, I actually pursued it as a clinical nurse specialist. It wasn't even in leadership. Loved being at the bedside, loved taking care of pediatric patients. And so that's where I thought I'd be. It wasn't until individuals tapped me on the shoulder and asked me to lead different projects or different units that I fell in love with leadership.
So you started out as a pediatric nurse.
I did.
And what was it about that you really enjoyed?
Everything. I love taking care of kids. That was the best part of it, because it really married my love for children, which was wanting to be a teacher, and really taking care of them. They're so resilient and they bounce back. And I think the most challenging part is sometimes taking care of the families when they're at their worst. So that was probably the most challenging part. And when I say kids are resilient, like they bounce back from things faster than any adult. When I look at the pediatric oncology population, which is one of the groups I managed and took care of, they were just they were remarkable. Things that we did to them, I will say that, different procedures, different things. And the only thing they look forward to is getting something out of the treasure chest. So, and then a hug afterwards. So it was very, very different than taking care of adult patients.
I'm curious, obviously, it's really rewarding when you have positive outcomes, but when you're in the medical field, that's not always the case. How could you compartmentalize or, sort of balance that without it having sort of take you over?
So I always told everyone I ever oriented or anyone I ever worked with, if you ever get used to those bad events, then it's time to leave the profession. or at least leave that area. So working in an ICU, when we would have codes, or even when you were on a floor and you had a bad event, you cried. You did go through the motions. While you had to go through the motions, they're very calculated, and you do what you have to do. But afterwards, you have to take care of yourself and you have to decompress. And there were times as a group, we would often just get together as a group after a bad event or a serious event, and you would decompress together. So, we're all in it together. And after I had my own children, I have to say that was a little bit more difficult. There were times that I'd have a child that looked like my child, or that we had a similar event, and I thought that could have been my child. And really hung on to that for a little bit. But it's really how you create a network that helps you decompress, helps you take care of each other. And I was fortunate enough to grow up in that kind of environment at Penn State Health, and they help nurture and develop you.
At Penn State Health. So you're a Nittany Lion, is that right?
I am a Nittany Lion. I graduated from their undergrad and grad school, and I am a huge football fan.
Oh, so we're recording this on January 3rd, 2025, the first ever expanded college football playoff format. We're going to go on just a quick tangent here because I can see you beaming from ear to ear. Penn State has earned the right to be in the semifinals. Where their upcoming game is, go ahead.
It's the 9th of January, and we will be playing in Miami against Notre Dame now.
Right. And if things play out well and Notre Dame wins their next game and my alma mater wins their next game, we could have an all Big Ten final, Ohio State versus Penn State. It would be fun to see a rematch.
Yes. Ohio State had quite the game with Oregon.
We did.
Yes.
We did. So we're optimistic and enjoying what's unfolded so far. So, all right. So back to, being a pediatric nurse. I'm curious, when you went through those, difficult and challenging times, when you were on staff, was there a formal behavioral support network, or was it more informal where you just kind of got together with coworkers and sort of cried together and leaned on each other?
Well, it was informal when it first started. I can honestly say that we had a great pediatric ICU. So I also was a maternal child float for 7 years, and I absolutely loved being a maternal child float. I was able to float in and out of different units, and in the pediatric ICU, they actually had a formal developed program where they would get together following the immediate debriefing. And so everybody that was on staff, if a code took place or something just happened, we could call the team together to actually help support them. So it was more regimented than any place else in the hospital that I worked.
And for those that are watching the video version of the podcast, you'll see that Kristen Dahl just joined us. She's the PR specialist there at Medical Solutions. So welcome, Kristen. Happy to have you here. I'm curious to hear, Patti, before you tell me about how the opportunity at Medical Solutions unfolded, paint a little bit of a picture for us, the breadth of the service offerings that are available there.
So Medical Solutions, as you heard earlier, it started in 2001, and it really was organically formed as a temporary staffing agency. And that's really the focus that it had, and then acquired a couple different companies that also helped support and broaden the breadth of what they were able to offer, what services they were able to offer. And then more recently started diversifying in the last 3 years, really acquiring international companies, working on direct hire, really working on how we support our clients a little bit differently with some technology and with services that are not just related to travel. During COVID, there were a lot of travel companies that started and really expanded because that was the demand of the time. And I don't think, even being in the hospital, I don't think that we could have ever survived COVID without travel. And the reason I say that is because if you remember how COVID, I'll say it popped in different areas of the country. And it moved rather quickly, and it really started to respond in different areas. We'd see, the epicenter, and then we'd see a lot of different pockets that formed. And we really didn't have the capability of moving staff or moving registered nurses other than travel in a way that could really stay ahead of that and really be able to localize teams or be able to move nurses in that way. And that was hard, as a nurse at a bedside, where I was the CNO of a hospital and health system. It was very difficult to watch a lot of our nurses leave and move. So I was hard pressed to say that I loved that because I was in the midst of really struggling to keep our staff on board. But it was hard when the salaries were what they were during that time. That's really what made the move of really expansion in the travel industry. But as we were coming out of the travel, really starting to shrink the demand of travel, that's where Medical Solutions started the diversification, as have other companies.
So started out as a temporary staffing agency, then because of the realities of COVID and how, their outbreaks would pop in different parts of the country, you're kind of forced into evolving the model because travel specialists, travel nursing professionals were in demand in different parts of the country at different times. So you guys had to go there. Now, as COVID kind of, started to wane, that need for travel nurses has cut back as well. And so now the new evolution of Medical Solutions looks like what?
Well, the new evolution is more of a full workforce solution. So we've listened to our partners and really helped where they have needs, whether it's an internal resource pool and helping them develop that, more technology to help with that flexible scheduling and the gig kind of workforce that our teams are really requiring, and then direct hire, really helping the organizations hire from a lot of different areas that their human resources or talent acquisitions can't reach. And then last but not least, our international programs. So we have a company that really offers a direct hire international, which is Worldwide Health. And that has been very successful in helping organizations recruit seasoned nurses, because after we saw the evolution of COVID, there were a lot of new nurses joining the workforce, and a lot of our seasoned staff have left. So that international hiring international nurses has been very, very successful.
And when you say international, are you hiring nurses from the States and placing them in other countries, or you're helping to hire people local to those geographies and place them locally?
Correct. So hiring from the Philippines, from Saudi Arabia, from England, from Canada, and placing them in the United States.
I see. To help fill in shortages that are here, correct, looking for highly trained professionals outside the country and bringing them in.
Correct.
And when you do that, is that a direct hire? Are they still employees of Medical Solutions? So it's more like a temporary or contract worker kind of an arrangement?
No, it's direct hire. So we work with the hospital that is contracting us to look for those individuals for them. So registered nurses, medical technologists. So there's a breadth of roles that they are looking for. And then we help source them. We find them and bring them over. They interview them and they make offers, and they become, once they join their team, they become their employee.
Is there still the core of the business model in the temporary, the contract workers that is part of Medical Solutions?
Oh yes, that's our biggest book of business that we still do. These are all other things that we've evolved, other services that we've evolved towards.
Yeah, other things that you can layer in
Mhm.
as you're getting feedback from your clients on what they need. And
Correct.
one of the things that I heard you say was that you've moved into the tech space. Is this like medical tech? Is this more like software tech, like they need inside the hospitals? What,
Mhm.
explain that for us.
Sure. So more software technology. So we leverage what we call Matchwell, and it's a company that we purchased about 2.5 years ago, and they can help an organization create their own internal resource pool, hire locally, and manage that local market with us.
And these acquisitions, this has been kind of a key part of Medical Solutions strategy over the past several years, right?
Correct. Correct.
Can you say more about that?
Yeah. So for the during COVID, as we talked about, travel was our key driver. And coming out of COVID in 2022, 2023, the CEO at the time really recognized that the clients that we served really needed something more than travel. And they needed other options to make their staffing models whole. And that was for a variety of reasons. Some of which we just went over. The fact that a lot of new nurses left the organizations and were scarce in really seasoned nurses. And that's really one of the levers for pulling in the international reason. The reason that they went to the gig workforce and really purchase a Matchwell was because they wanted more flexibility. They heard from their partners that they wanted more flexibility. They needed a mechanism in which to manage that staff differently. So that's really the impetus, because they truly do listen to the individuals that they serve in what are their key strategies and what are they looking for, and that's how we're evolving.
Well, it's a very smart strategy. You want to know what to sell, listen to the people who are buying, listen to your customers, they'll tell you. So now that we've got a little bit of a better idea what Medical Solutions does, tell us how the opportunity for you to join the organization came about.
Well, that was a little by accident. Actually, I wasn't planning on leaving. I loved what I was doing. I loved the fact that we were moving towards filling our vacancies. We were evolving as an organization, and I really did appreciate where I worked. And by accident, I actually answered a recruiter's phone call. That's the honest truth.
Oops.
And that recruiter had tried to contact me a couple times via email and LinkedIn. And I really, during COVID, CNOs were recruited on a regular basis. I was getting 10 to 12 calls a week.
Wow.
During 2022 into 2023. So I ignored most of them. But I picked this one up and shared with her that I would talk to her in a week and a half if she wanted to send me the information, gave her a date and time, and she did it. So she called me and just asked me to speak to the CEO and the chief operating officer. And so I did that. And I appreciated them both and appreciated what they were sharing with me. They answered the questions the way it aligned to what my views were and what I was thinking, and allowed me to be innovative. They really wanted to hire a chief nurse to be able to relate to the chief nurses that they served and how we could design programs and solutions together to help them.
So I've got a few. I'm sorry, go ahead. I cut you off.
So that just helped me make my decision.
I've got a few follow-up questions. First of all, let's take a step back, though. And most people have heard of a CEO, a COO, CFO. What does a chief nursing officer do? Paint that picture for us, if you will.
Sure. So in a hospital, as a chief nurse, you're responsible for patient satisfaction, employee engagement, quality, and safety. you're responsible to really drive the employee engagement because nursing is by far their largest workforce. And so those were all key strategies, key parts in performance, and really managing the staff, making sure the right people were competent to take care of the patients that they were serving. And so now, the chief nurse in Medical Solutions, I'm really the liaison and really helping strategize. So I spend a lot of time in strategy with my partners that I serve. And we have what we call MSPs. And those MSPs are our partnerships that are exclusive to working with us. So when we have a partner that I work with them quarterly, and we share their business strategy, where they're at, how they are leveraging our services, and then we talk about what are their strategies and how do we better serve them. And so it's really creating those kind of strategies with them that we can help complement.
And so MSP, this is managed service provider, and this is basically like a like a preferred contract, a preferred arrangement, so that you're a preferred vendor with them.
It is. That's exactly what it is.
Okay, so you were being pursued multiple times per week during COVID to be chief nursing officer somewhere else. Kept saying no, I'm busy. I'm happy where I am. But accidentally, you end up on a call with the CEO and COO of Medical Solutions. What was it that they said to you that, was such a big deal that had you changing your mind on all that?
Well, I love the fact that they said they wanted to hire a chief nurse. They seem to know how to use a chief nurse, right? So okay. They first had really decided that was a role that they were extremely interested in. It was going to be the first one in their organization. And they wanted me to partner with other organizations, to be innovative, to strategize. And I love those parts of my role. Didn't get to practice as much in those roles during COVID because you were really just putting out fires and responding to, crisis all the time. So that really allowed me to, I think, leverage a lot of my strengths and the things that I love to do. So that's probably the biggest thing. And both of them were in sync. So they both independently, 2 different interviews, said the same thing. So that also resonated with me, where they knew exactly what they were looking for. They were in lockstep, and I felt like they would really give me the liberties to help evolve the role.
You made the point a couple of times that they allowed you to be innovative. What are some of the innovative things that you've been able to introduce there, Patti?
Well, one of the things that we have done is the internal float pool kind of concept, that resource pool, and helping our partners really understand how do they leverage creating their own pool of individuals where they can move them. Health systems have really started to merge, and acquisitions have been at an all-time high in the last several years. And so with multiple sites, how do they help create their own flexibility so that they can move individuals? Almost all hospitals have had float pools for years, and they're within the boundaries of their building, right? So they operate within their building to create that flexible moving of staff to where the need is. So this really takes it the step further in really building an infrastructure where you can move staff from one hospital to the other, all within the same health system, that allow them to be a lot more flexible and nimble in providing care, and in a more economical way than doing it with travel. We have created a lot of opportunities for our nurses to think differently, and whether it's creating succession planning for their organization and how they leverage different potential clinical ladders or career ladders that they have. So some use it in nursing and others use it in their laboratories or their radiology departments, but really building an infrastructure to invest in a person and saying, here's how you can build your career here in our organization. So those are a few of the things that we've done with our partners. The other thing that we've worked with them on is how they create a process for really creating, when you have a good travel clinician that you're really interested in keeping, how do you create an infrastructure to be successful in doing that? And I know a lot of places say, why do you do that? Because that's really, moving individuals into a core role, but it's really when you want to service your team, and your team includes your partners, that really is what we've evolved towards.
A couple of follow-ups there for you, Patti. So the internal float pool idea, is this utilizing the employees of your partners, we'll call it the hospitals that you place folks at? Is it utilizing the staff that you're placing there, or a combination of the two?
It's usually a combination of the two. We usually start up with, we start them up running with our own team, and then we build the infrastructure for them, and then they staff it. So it's an evolution of it. Sometimes it's our staff. It evolves towards being more of their individual staff that are moving between their hospitals. And then oftentimes when they need travelers, they'll put them in the float pool just to create that largest opportunity to move them where they need them the most.
I mean, what you're describing sounds very customer centric, right? This is what the customer needs. This is benefiting them. But it's probably taking away, if I'm looking at this objectively, it's probably taking away from your own bottom line, right? If they were less efficient with their labor pool, they probably need to hire more of your temporaries to come in. Am I thinking about that in the right way?
It's true. But in all honesty, if you're going to be a full service provider and you really want to be a partner, which is what I really do appreciate about Medical Solutions, is that that's part of the partnership, is that it's a give and take. It's about what do you need to do to make your team successful. The other thing, that if it's not us, it's going to be somebody else, right? Because honestly, travel alone is not sustainable for organizations to rely on travel the way they did in the past. So if it's not us, then it's going to be somebody else that will help them.
And this goes into what you were just saying about, creating an infrastructure to help your customers be able to keep a traveling nurse provider that, they really like. Again, that is sort of taking away from your bottom line, but you guys are taking a much more holistic approach and saying, hey, what's best for the customer? And if we can figure out what's best for them, things are just going to take care of us naturally.
Correct.
Yeah. And I really love this theme, and I've heard this from a number of my guests where for some of them, it kind of comes in a light bulb moment where they were like, whether it was for the business or for themselves individually, they were really focused, me. Like, how do I get more? And when they eventually switched to, how can I give more? How can I deliver more value to the people that I'm interacting with? Like, the opportunity started to flow, the bottom line improved on its own. Like, it's just, everybody was more in sync. Is that kind of how you and Medical Solutions think about things?
Without a doubt. And that's when you think about what I would say differentiates us, that is the way that we think. It is really around, how do we provide the best value? And value isn't just about the cost, it's about the quality. And how do we do it together?
Patti, tell me what the Voices of Care survey is.
Sure. So we designed the Voices of Care survey a couple years ago, really trying to identify, what do clinicians think about? What do they care about? What's important to them? So we surveyed many different nurses, whether they were travel clinicians, they were core to organizations. We just sent out a survey. We had more than 7,000 responses. to these clinicians who responded and shared with us what's really important to them, and that's part of the other piece. It's not just about what does the client partner want, but how do we service the clinician in a way that makes or understand the role of the clinician in a way that models and makes our decisions easier, right? So that we're doing what matters. You as a leader, I think, and I've learned this over the many years as you articulated of nursing that I have.
There's a lot of wisdom in those years, Patti. That's the only point I wanted to make there.
There is. But what I have really truly learned in my leadership opportunities is that we can work on a lot of different things. There's never, you're never done. As a leader, you are constantly working on things. But if you're not working on the right things, then you're really missing the mark. And so that's the reason that as a leader, I have always found it very important to understand what's most important, because what might be most important in one of our rural settings is very different than maybe a large urban or an academic medical center. And so really understanding what's important to them helps shape our strategic plan and helps us determine what's next and what are we working on and what do we want to work on in the next 1, 2, 3 years.
Can you share maybe just a couple of the key insights that you've picked up from doing this survey?
Sure. So clinicians have really shifted their mindset on work-life balance. I think that's one of the really big things that has come out in the last several years. And, I think they've figured out that it's not just all about your work, and it's not just all about your work doesn't define you. When I think about, I'm a Gen Xer and I'm on that cusp, and it was my work defined me and what I did, how I served as a member of the team really mattered. And I'm not saying that has shifted, but how many hours I'm willing to work and how much overtime I'm willing to give you does make a difference. And so we have to really think and reimagine how we staff and how we, expect that. It used to be when I was a leader at the bedside, I really depended on people to do overtime a lot more than they do now. And I think that's the right thing to do, really thinking through, I need to provide the number of nurses that I need to staff a unit. And instead of thinking about it in a 75-25 contingent kind of model, 75% core and 25 contingent, it might be now more 85 or 90 core and a little bit less contingent. Just because I think that's what they're expecting. They're expecting us to plan differently and utilize resources in a different way. So that's the first thing. The second thing is flexibility. They want to have flexibility in their schedules. They are not going to work full-time nights forever, and if it works for their schedules, but you have to offer a blend and a mix. And that's really important. And that was not something that we heard consistently before. Pay has always been a big thing, and pay will continue to be a big thing for healthcare workers. And I always say I have 3 children of my own, and they're all independent and out working in the workforce. And they all say they're not paid enough either. So I don't know that it's just nursing. But I do believe that is consistent and will stay consistent in the near future.
So, this idea of work-life balance becoming a lot more important, people not wanting to be available for quite as much overtime. Logic would tell me that this is probably, at least in part, contributing to some of the staffing shortages. Am I right?
It is. Mm-hmm. It is. And it really challenges us to think differently about how we create staffing models and what what's important to make sure that we're supporting them in a very different way.
It seems like this Voices of Care survey would almost be like a competitive advantage for you, right? You've got such a large organization. It's grown both organically as well as with acquisitions. So you have a lot more data points from which to collect the data. And the more data points you have, like the better picture you can sort of paint for yourself on where are we, where do we need to be. Do you think about it in that same way because you're such a large organization that this is just giving you even greater insights into how to better serve your workforce?
Yes, well, that's one of the reasons why we do it, right? Is so that we can gain that insight, but we also share it. I share it in multiple different forums.
So this isn't just private data for you.
Okay. We have done both. We've shared it in podcasts. We've done we've actually produced some of the data that we use in different topics that we speak to. We leverage that data as well towards that, because I think it's really important as an industry. At the end of the day, we have to figure out how do we help cultivate and really grow the profession of nursing as well. And it's not going to happen just because Medical Solutions has this information, but how do we help across the industry work with the data that we know and what information we have so that we can pull the right levers?
Patti, as the Chief Nursing Officer, I'm curious, how do you ensure whether it's travel nurses, allied professionals, contract workers that you're placing, remain just as supported and engaged as permanent staff, despite being, on the move?
Yeah, so we've put several things in place in the last several years. So we started a traveler rest up, and I love data. So let me say that I love to take data and use it to help create new programs. So we looked at our data that was saying we had 2.5 assignments were what was typically happening in our organization. So an individual who set out to travel was typically traveling with us for 2.5 assignments, and then they were finding their own way or whatever. But we started then dissecting why are they leaving and said, you know what, I think we could support them differently. So my clinical team, that is a group of registered nurses that helps with interviews and make sure that we have competent and clinically sound nurses on assignment, actually started a program where we help support the traveler on their first assignment. So during their first assignment, making sure that we have their questions answered, that we put an infrastructure in place to support them with recruiters, question and answer, seasoned travelers. We've been bring seasoned travelers in and kind of give them the tool of the trade, right? Here's what we've learned. Here's best practices. So that it helps avoid pitfalls and it really helps position them well for their travel assignments. So we do that. I have that same clinical team also has an opportunity to really coach and develop. If somebody's on an assignment and they're struggling, whether it's clinically, professionally, behaviorally, we get involved rather quickly and start that coaching and how do we help mentor them? And then we do follow-ups afterwards to make sure they're on the right track and that they feel supported. And if they identify a gap, and there have been times where I've then gotten involved and worked with the leadership in that hospital, and how do we help support that team differently? And I think about one of our groups that one of the partners that we've worked with, and we've put about 5 or 6 different things in place that really help support them in a very different way, from individuals meeting with travelers the moment that they get on assignment. So they work with them every month to meet with them and make sure that their needs are met. making sure that they know where their policies and procedures are. It's just that extra step in going that extra mile. We also share with our partners what the post survey is. So we survey clinicians when they leave their assignment. So after they finish their assignment, they get a survey to tell us about the hospitals. So as part of our quarterly business reviews, we do share with our teams what the clinicians say about them. And that's the positives and maybe some of the constructive feedback that they can learn from. So that helps us really create an environment together, because I see the traveler like a secret shopper, right? They're in your organization and they can tell you where your warts are. They can tell you exactly where you need to work. And I'll tell you that every one of the CNOs that I work with really appreciate that feedback, because it's an opportunity for them. Many times they already know it. It's rare when it's a surprise. They know that they have a problem there, but they just haven't addressed it maybe, or, they're coaching them or they're working on that area. But for the most part, it's not a huge surprise.
It's interesting because it seems logical to me that, having one of your travel nurses sort of, surface an issue at a place that they've just recently arrived could create some internal tensions there. Mm-hmm. But you're saying, and I'm sure that there's some of that goes on, right?
Sure.
But you're saying by and large, the CNOs that you're working with at your client sites, they're actually happy to have somebody raise it. They probably already knew about it, but maybe this is just giving them the excuse or the reminder to do something about it, to sort of surface it to the top.
Correct. And, so I would say to your first question, or to your first point about sometimes it creates that tension. So it's how you say what you say, right? And I think that's one of the things that we do when we coach. If somebody's brought up, this person just brings up all the negatives in this organization or is coming across as negative, that's part of the coaching that can take place. Is you may identify a problem, right? And it's how you bring up that problem that makes or breaks the acceptance of what you're saying. And so as part of the coaching opportunities, it's really about how do we frame this in a way that's going to get you the attention that you need? And how do we help them bring it up so it's constructive? And I'll be honest with you, when it's reframed, it's not viewed as, well, here's Patti Artley coming and bringing up all these problems and, and just looking as being negative. It's really about how does she want to make this a better organization, and how when she's seen it in 3 different other organizations work in a different way, maybe bringing up, have you ever tried? Or I can share that in another organization, this is what they've done. And it's that ability to be able to give that feedback in a way where it's going to be received and reacted to, or responded to instead of reacted.
This is such a great reminder, even for me, Patti, and probably for a lot of the listeners as well. You what's the old saying? You catch more flies with honey than vinegar. And so the way that it's presented makes a huge difference. Okay, so you've got this problem. Do you come in and you just complain and, throw it on the floor and this is terrible and you guys are awful people? Or do you reframe it as, hey, we've noticed a challenge here, right? We've had some other clients who ran into something similar, and we thought we might, propose some solutions if you guys are open to it, right? It's a completely different conversation. You bring a totally different energy to it, and you're much more likely to get some forward motion on it.
Yes. And when we know there's an issue or a situation, what I will often do in the quarterly business review is share it as best practice. So we want to share best practices. Here are the things that we're seeing out there with many of our partners. We're wondering if any one of these is of interest to you in a way that we can come and help. right? So it really is, when you're in a true partnership, you look at it like they're here to help instead of they just aren't. They're just here with the service, and it's a vendor kind of relationship. And that's what we do not want to create, is just that vendor kind of relationship. It's that partnership.
Well, which is something that we just talked about a few minutes ago, right? You guys have taken it from, hey, what's best for us and our bottom line, to how can we best serve our customers? And so this all kind of feeds into itself, right? So that when you come to them with an issue or a challenge, they don't view you as strictly transactional, because you've made it clear to them that you don't view them strictly as transactional. And so they're more receptive to that conversation, right?
Mm-hmm. Yeah. Correct.
So, one of the things that we heard a lot about during and coming out of COVID, particularly in the healthcare field, was burnout, right? People were being asked to do a lot in a really scary time. People were stretched really thin. What does all of this look like now, as we're recording this at the beginning of 2025? How would you, sort of taking the temperature of the healthcare field in general, where would you say people are?
Yeah, I think it's a lot better than what we were talking about in 2022, 2023. There are a lot of tools out there to assess burnout, and some of our partners have used them. Some of our partners have not. I think what's most important about burnout is that it doesn't look the same. It doesn't look the same for individuals, and it certainly doesn't look the same in units and organizations as it does in other units and organizations. So I learned that rather quickly through COVID. We did a burnout survey for our own team at MUSC, where I worked in. Different units were struggling with different things. So the ICUs that were seeing a lot of death and dying were really having a lot of moral distress. The moral distress on a med-surg unit was more related to the fact that they couldn't meet, with higher ratios, they couldn't meet the necessary needs of their patients. They might not have gotten a bath every day, or they might not have gotten, to do the things that they think made, and what all of us as nurses think makes the whole package, right? So it's not just about dealing with the task at hand, but how do you care for the whole person? And so what they were struggling with was very different. So you didn't have a one-stop shop for, how you addressed it. That's what made it very difficult. It was very customized and individualized, and you had to throw a lot of resources at it to make it meaningful. Now, I would say that the focus is really on the well-being of our organizations, and a lot more focus on that coming out of COVID. And that is really not just the physical, but their mental and their emotional and their financial, which I think is really important. And that's what organizations are doing across the industry and across all of our healthcare settings that are being very successful in addressing them. I think the other thing, and it goes back to what nurses say, they want to know that you're invested in them, right? And so a lot of organizations are going that next step to really help them develop a plan on how they help grow them, how they help nurture them and support them in a very different way. So I see that in most of the organizations that I'm going in, and I can honestly tell you that probably was not the core focus of many of these organizations prior to COVID.
One of the questions that I love to ask most of my guests is, hey, labor market's still pretty tight, hard to find and hold on to good folks. What are some strategies that you've tried and found success with? And I'm hearing you, volunteer up, some of the things that are going on. And I'm curious, as you talk about being more focused on employees' financial, emotional well-being, kind of, the whole picture of the person. Can you give some examples of what that kind of looks like in a practical, real-world sense? Like what somebody who's working for you, what's something that they may get from Medical Solutions that they weren't accustomed to getting somewhere else?
So we have culture teams that really are I'd call them either like an engagement team that really pays attention, and they're employee led. So they tell us what do we want to work on, and what are we interested in seeing as part of our benefit package. So we have a well-being. One of them is a well-being impact team, and that well-being team is really focused on, and our benefits are actually focused on the physical, mental, financial, and emotional well-being of our clients, and of our employees, and really how do we give back to the community. That's part of that team as well. So volunteerism, we support it, we encourage it, we pay for it. So we pay our teams to go out and volunteer and pick that service that they would like to provide, and we support that. And we encourage it as a team so that it is a team building environment. We do, one of the things that we're just in the process of planning is that physical challenge. We just did one in December with my own team, and in April, we're planning it for the entire organization, so that we do a platform, and you log your success, and you do it in teams. And really, it's that opportunity to take care of yourself and know that it's important for us that you take care of yourself. And we offer flexible PTO for our teams, and really encourage them to use it, and how they take care of themselves, and I think a really strong benefit package that supports that mental well-being, and knowing that, taking care of yourself and taking care of your family is really important for you to come to work every day as your best self.
Lots of really interesting and impressive things that you brought up there. One that kind of jumped out to me is the community involvement. And you actually pay your employees to go volunteer somewhere else.
Mm-hmm.
Patti, this isn't adding to your bottom line. This is taking money from it. Like, walk me through that thought process.
Sure. So, so groups like my clinical team or credentialing team, or any one of the teams in the organization, pick a program that they're passionate about. For me personally, I've been on the board of Ronald McDonald House for years, and so we would give back to the Ronald McDonald House. One of the things that we did last year was we went out and we wrapped presents for kids in an underserved area, where it was really an opportunity for us to build a team. So our entire, leadership team divided in half. Half of us went to do that, and half went to another, to a food shelter. So really, what's important to us to make sure that we're taking care of the community as well that we serve. And I think, you can nickel and dime, or you can really determine that what's important is that you're taking care of the people that you're serving. And as a leader, that's the reason that I love Medical Solutions and why I want to work here. We've had our fair share of problems as an organization, right? Our book of business has had a downturn, but we still stay true to making sure that we're supporting our partners, the people that work for us each and every day, and our clinicians that we're putting on assignment. So there are a lot of, I think, ways that you can choose to deal with that. But as long as you have a balance and a blend, and you're moving with the right intentions, I think you weather them rather well.
I like that. Patti, I want to shift gears for a moment and invite you to talk about a serious challenge that you've overcome, either personal, professional, combination of the two. What that was like going through it, maybe some lessons that you learned going through the other side of it.
I think the worst professional was probably during COVID. We had a lot of our staff leave, as did most hospitals, whether it was to the retirement, left the profession, travel industry. They had to take care of children at home and couldn't straddle 12-hour shifts and try to be homeschooling children. Healthcare had a lot of that. And the other competing factor was we had so many unknowns about the disease and the disease process. And as a leader, I felt like we did whack-a-mole kind of leadership, right? So we were in constant react mode. And that for me was a huge internal struggle, because I really like to be proactive, look at data. There's no time to look at data during COVID. Somebody else is deciphering data for you and telling you what to do. And sometimes that changed 4 times in a day. Different messages would come out, or different mandates would come out from different governing bodies. And it was very difficult during that time to get through and navigate those. One of the things that I really learned during that time, because we became insular and isolated and we reacted all the time. And it was when we got back to that, going back to our basics and leader rounding and getting on the units and really understanding the challenges and the infrastructure. We always knew that was the most important part, but it was really difficult when you're trying to stand up units, staff units, do all of those things that don't allow you to be strategic and proactive. And so really it really underscored for me the importance of being present, the importance of understanding what your team needs and focusing on the right things. And so that's one of from a professional struggle, that's probably, I think, one of the biggest challenges I had, and the biggest leadership challenges that I had by far.
What did you find was a good coping mechanism? How did you get through those challenging times? Was there a support network of other chief nursing officers? Do you have a great partner at home? I don't know. Like what was your sort of escape or go-to?
Yeah. So honestly, I was the president of South Carolina Organization of Nurse Leaders as well. So That was at the same time. And we pulled all the chief nurses across the state of South Carolina together to do best practices and lessons learned. And a great partner with the South Carolina Hospital Association, they stood it up, knowing that there was no way that any of the CNOs could stand up that kind of thing during, the fires that we were working on. So I had a great partner there, and she was just compassionate and helpful. And the fact that you recognize that all of us were in it together, we were sharing best practices. We moved from competitors to collaborators and really stopped thinking about how do we compete for business, because honestly, none of us wanted the amount of business that we had. To be completely honest, I would have given away a lot of my units to anybody, but I think just knowing that we're all in it together and that we were collaborative and sharing best practices was probably my best support through all of that. I had a great leadership team, absolutely phenomenal leadership team that I worked with at the time, both as my, my day-to-day COO partner, my chief medical officer partner, my CEO. They were just phenomenal and were great to work with. But my leadership team that worked with me through all of that was supportive, was understanding, caring, compassionate, and truly I couldn't have been prouder of them. So I think those were my biggest resources and my biggest supports.
That's great. What kind of future innovations can we look forward to? You're an innovative person. You've already implemented a lot of really neat things there. what are some things that are coming down the road?
So I think we're really going to be looking at how do we help support with virtual right now. So how do we think about providing care in a very different way, and looking at what is the partnership, or what are the platforms that we can help support. Nursing's really provided care in the same way since the 70s. And we have to think about that differently if we're going to be successful. And nurses are going to continue to churn at the bedside unless they feel like what the work they're doing is allowing them to practice at the top of their license. So I think that virtual care is going to be paramount to being able to provide care in a different way. So I think that's one of the things that I know that we are looking at, and how we create care in a different way.
And is that through providing that care through some of your partners, doing it sort of more as like a home-baked model, or not sure yet, still sort of exploring?
We're vetting that out right now. Right now, we support our teams that have virtual nursing right now through placing travelers in their systems. But expanding on that to make sure that all areas, especially some of the smaller rural areas, how do we help support them in a different way? Because they have very minimal and limited resources, and how do we help provide that care? The same person who is the registered nurse does just about everything in some of these rural. They're cleaning the rooms, and they're serving the meals, and doing, everything from soups to nuts. And so how do we help really elevate them and give them some extra support?
It'd be interesting to see how that unfolds for you.
Yeah.
I just have one more question for you, Patti, but before I ask it, I want to do two things. Everyone listening today, I know that you like today's content. Patti has been amazing. Please hit the like, share, subscribe button on your favorite podcast app. Patti, I also want to let people know the best way to get in touch with you. What would that be?
So we can provide with you medicalsolutions.com. So Kristen, who's on the call and not showing her face right now, but Kristen actually manages that website. We have a team that manages that website, and anytime anything comes through that's clinically based, it comes to me so that I can help and help navigate.
Great. And it's a super easy website to remember and spell, medicalsolutions.com. Check it out, everybody. So last question for you, Patti, whether you think about the medical solutions business or your larger industry as a whole, I'm curious what you see being the big changes that are coming in the next couple of years.
Yeah. So I think we will continue to see organizations, whether they are staffing organizations or whether they are hospitals, continue to acquire at a large rate. I really think that it's necessary, and something that is inevitable. I think that you will continue to see diversification of the services that are provided in the industry, as well as for hospitals and health systems. They have to be innovative, and they have to be creative in the way they provide care. Healthcare reform continues to make payment strategies and reimbursement strategies very difficult for organizations. So this is why that innovation, I think, and partnership and collaboration is necessary to make them stay afloat.
Why do you think that the mergers, the acquisitions are so necessary at this time?
Access to care. So I think that if we're going to continue to provide access to care in a lot of our smaller areas and throughout the states, I think about the states that we serve, and even the state I live in. I live in Charleston, South Carolina, where it's a little more populated, but the rest of the state has a lot of access to care challenges. And if we don't support and acquire and partner with some of those smaller hospitals and some of the areas would just not have access to care. And it's so critical during this time. I think the virtual platform, which is why one of the things that is important to me, we were able to provide access to care through telemedicine throughout the state. And we converted that during COVID, and it continues throughout the state and throughout all the school districts in South Carolina, even today, because there's just not other options. And so it's going to be being creative, providing care in different ways. I think that virtual platform, the AI technology that's out there, and really helping leverage those different technologies to help provide the care is required for access at the end
Where
of the
do
day.
you see AI fitting in, or how is it currently fitting in for what you guys are doing?
Sure, it helps us create, it pulls data elements from multiple areas. So when I was the chief nurse at a hospital system, we leveraged it in our early warning symptoms and systems. And it was really pulling data elements that, I might not all put together right away. And I think that's critical, especially as we have newer nurses at the bedside, really helping them, alert them that this might be a problem. So that's where hospitals are using it. They're using AI to help pull data elements from the monitoring systems into the technology that's their documentation system to help them make better decisions. It's really proactively helping you schedule. What does the data look like for your last three years? How do you use OR utilization data to help you make decisions about how to staff an OR, or when to staff the organizations that are supporting that? The inpatient units, the PACUs, all of those areas that support operating rooms. So it really does allow us to leverage data in a very different way and help us make decisions. At the end of the day, it's not going to take my place. It's going to help me make better decisions and hopefully better patient outcomes, better staff outcomes because of it.
Well, that's exciting to hear. This isn't an AI, maybe it'll happen kind of scenario somewhere down the road, possibly in the future. This is what I'm hearing you say is, here's how we're already using it right now. And here's how it's helping us improve and allowing you to be more effective at your job, allowing you to support your employees better, and ultimately delivering better patient care, which is the ultimate goal at the end of the day, right?
Agreed.
Yeah. Well, Patti, I want to thank you for being such an amazing guest. I appreciate you sharing both your time and your story with us today. Thank you.
Thank you. Appreciate it.
Well, folks, that's a wrap on another episode of the Inspired Stories podcast. Thanks for learning with us today.